Hi, my name is Brian Murray, licensed mental health counselor with the LifeWorks group located in Winter Park, Florida. And this week's question is, can a narcissist be treated in counseling? The short answer is yes, it can. It really depends on which counselor you ask. Some will tell you no. It's a waste of time. They've tried it. It's useless. It's time consuming, and it's just a waste of time for the client and the counselor. So it really depends on who you asked. There are some of us out there that will work with a narcissist. I have in the past, and I can tell you there have been times where I have helped a narcissist recover from that disorder. It's very time consuming. It can be trying on patients, on your patients, not like medical patient, but your patients, um, in terms of for the client and the therapist, both will be at times frustrated. I can guarantee you that. Because basically, what you're trying to do is you're trying to change somebody's personality. You're trying to help them work through everything they've ever learned in their lives to try to overcome who they are. Okay. The reason why they come to counseling is because they've reached a point in their lives where they're in some sort of pain, addiction, their marriage is on the rocks, their career is not going the way that they wish that it did, and there's some level of pain involved that they can't seem to be able to process or work through. So they come into counseling for that pain, and then through discovery, the counseling process, there comes a realization and diagnosis that there's narcissistic personality disorder. So what do we do with that? Well, the first thing that we have to do in treating a narcissist is to help them build awareness of how their behavior is working against them. And once they do that, which can take, typically, it's been my experience, up to 6 months, um, they begin to understand how things that they've been doing are working against them. And then you can introduce the diagnosis. The diagnosis doesn't come right away because the sensitive ego of the narcissist is not going to receive that very well at all. And it basically equates to nothing more than name calling. They get offended and they'll run away on you. So they're not being treated if you start off with a diagnosis. So you build awareness. 6 months in, you can introduce them. Ask them how they feel about it. How do you feel about this thing where I see this going on, and you kind of have to sell it to them a little bit. And so you kind of ease them into the process. If they accept it and they say, yeah, I totally see that and I understand where you're coming from, and they're beginning to build some of that insight, hey, we're about halfway home now, because everything that comes on the backside of that has to do with teaching them how to be empathetic and empathy building, and something called bilateral communication, which is very, very important. Maybe I'll do another video on that, which is about understanding how their words and actions are impacting other people, how that makes them feel, and to understand how that how they express themselves is actually making another person feel, and vice versa, how they're interpreting information. So there's bilateral communication. So to understand empathy, bilateral communication, and the skill building skills that come on the backside of them beginning to open up and receive and understand, and you have to understand, you can't send a narcissist to counseling. You can't threaten them into counseling. You can't coerce them. They have to want it. It's usually the pain that drives them in, and it's up to an experienced therapist who understands that this is what is going on with this person, and to be able to talk to them in a manner of which can lead them through this. You can't do it. You can't confront them. They'll breathe fire on you and run away. I call it poking the dragon. You poke a dragon, they're going to breathe fire, they're going to burn up your office, and they're going to run out the door, and they're gone. And they never got the treatment that they needed. So there's this process that you go through. There are all kinds of techniques that you can use. One of them is called schema therapy, which is understanding how they operate as a person, and the theme of their life, and all the critical and demanding parenting voices that they've carried with them through their childhood, and how they talk to themselves inside their own mind, and interpreting events in their life and things like this. along with cognitive behavioral therapy, which is some level of rationalization. My understanding is dialectical behavioral therapy can be effective, especially if you have a little stronger case of narcissism going on, because they need to be able to regulate their emotions, much in the same way another condition called borderline personality disorder does, which DBT was developed for. So you got to look at all these different things. There's a lot involved with treating a narcissist. It isn't just coming in and getting some coping strategies and going home and trying to apply them. It doesn't work that way for this population. They need deeper psychoanalytic or psychodynamic type work where we get into the whole root cause analysis of where it came from, how it's working against them, and beginning to help them through some very, very difficult changes that could take up to 2 years of consistent ongoing counseling to walk them through this. I've seen shorter time periods, but typically 1 to 2 years is very normal for the time frame for the treatment and healing. Beyond that, it's going to take some follow through. I would always encourage a narcissist who has recovered to continue with supportive therapy every 1 to 3 months for really basically the rest of their life. Think of it as somebody who's gone through an addiction process. They don't just say, okay, well, I kicked my habit and now I'm just going to go live my life. No, usually there's some sort of ongoing support there and counseling that they go through. They just continuously keep up with it. So they learn to recover and then ongoing management, and it's possible. This is doable. It can happen. Does it happen very often? No, it doesn't, unfortunately. Usually the reasons why a narcissist doesn't get healed is because they get frustrated with the process. They feel like it's not working, and they don't hang in there for the long term, and so they quit the therapy and they just go on and live their life. And it's unfortunate and sad that somebody evaded an opportunity to get healed. So, well, I hope you have found this video helpful. Once again, my name is Brian Murray. I'm with the LifeWorks group in Winter Park, Florida. I'm a licensed mental health counselor. I do specialize in codependency, boundaries, relationship issues, of which narcissism is always a big part of what I deal with my clients. So if you are interested in counseling, I'm available to Florida residents either by phone, video, or in person. My phone number here is 407-647-7005. And thank you for watching my channel. I hope you found this helpful today, and come back if you find this information useful. I do one question a week, a popular question that I see floating around a lot, and then I try to provide some answer to that. So thank you for watching my video. Bye-bye.